Okay, this video is called Reefer Madness. Does marijuana cause brain damage? All right, starting, first of all, it's well known to cause amotivational syndrome. Everybody remembers that there were kids at their high school or college called potheads. Then it becomes often a springboard into other substance abuse, so it leads to polysubstance abuse. It's often ingested with drinking alcohol, and eventually they're looking for stronger, better stuff, and they start abusing other drugs. Sometimes it's laced with PCP. They often have inaccurate time perception. They very commonly have impaired short-term memory, can have impaired long-term memory. I have a lot of friends that are neurologists, okay? They'll tell you you don't ever want to smoke marijuana. It routinely causes brain damage. Over time, they get a smaller hippocampus, that's the memory center of the brain, and lowered IQ. They're more likely to drop out of high school. It causes damage to their lungs. It can precipitate episodes of atrial fibrillation. They'll have a tendency to develop an emotionally labile, volatile personality, which is very unpleasant for other people. One of my least favorite people to ever speak to is these marijuana people, because they sit there, they're stupid idiots, and they try to convince me they're smart for using marijuana. I'm like, oh yeah, right. I always just try to escape the room somehow as fast as I can when I talk to them. They're like hopelessly stupid people. They have increased risk of suicide. It'll sometimes precipitate schizophrenic breakdowns. The schizophrenic breakdowns are then sent to be managed by psychiatrists. Psychiatry is probably the worst field in medicine. They don't know what they're doing. They're very dangerous to the patients. They hurt far more patients than they help. They'll typically put the patient on an antipsychotic. All psychiatric drugs cause brain damage, and the antipsychotics cause it the most rapid. It can rapidly cause a partial lobotomy in just a couple weeks. So it's very dangerous to put patients on those medications. I'll actually give you a link to Dr. Joseph. He's a psychiatrist, and he'll show you some case studies of patients who got chemical lobotomies from these antipsychotics, and he knows a lot, that guy, about psychiatry and psychiatric medicines. So anyways, stay away from pot. If anybody offers pot to you, run in the opposite direction. It'll destroy your life. It's not a joke.